Hey everyone, welcome back. We're diving into some really crucial stuff today, especially for all of you working your way through nursing school.
Yeah, getting right into it. We're tackling informatics today, specifically in community, population health, and consumer education. Big topic, huh?
It is, but honestly, understanding this stuff, it's like getting a cheat code for navigating how healthcare is changing. Think tech, information systems,
Yeah.
it's all reshaping how we deliver care and how patients learn about their health.
It really is. We've got a solid learning plan laid out in front of us, and our mission, if you will, is to pull out the absolute key takeaways about how digital tools are totally changing the game.
And by game, you mean like revolutionizing healthcare delivery, right?
Exactly, and empowering patients, giving them knowledge they can actually use.
Love it. So to do that, we've got 8 major learning objectives to hit. Think of these as like the core knowledge areas you need to know about. Ready to jump in?
I'm ready.
Okay, so first up is designing online health resources. But here's the thing. We've got to tailor these for different generations and cultures. A one-size-fits-all approach just won't work in this digital world.
Yeah, you've got to think about how people learn, how they engage with tech. All of that's influenced by their generation and background.
We're talking baby boomers, Gen X, millennials, Gen Z. They all have different expectations. Then layer on top of that the importance of cultural sensitivity. It's complex.
It is, but also super fascinating, right? It's all about making health information actually make sense to the people it's meant for.
Absolutely. And it's not just design. We've got to understand how to use tech to actually teach people about their health day in and day out.
Right, how to make this stuff practical and relevant.
And then, and this is huge, how to sort through the mountain of health info online and know it's reliable. Because, let's face it, not all of it is.
That's where critical evaluation skills come in. We've got to be able to tell the good stuff from the, well, not so good stuff.
For sure. And on that note, we've also got to understand how governments are using informatics to boost health literacy.
Because they're playing a huge role here, right? Setting up systems and policies that can make a real difference.
Okay, and we're just getting started. We're also diving into the whole concept of learning healthcare organizations.
These are systems built to constantly improve. Think data, tech, research, all working together to deliver better care.
It's a whole new way of thinking about healthcare delivery. And then there's AI. We got to talk about that. It's everywhere.
And in healthcare, it's expanding our knowledge in ways we couldn't have imagined even a few years ago.
Seriously. Then we'll zoom in on the specific tools being used for community and population health.
Using data to improve the health of whole communities, it's pretty incredible.
Really is. And finally, we'll wrap up with the socioeconomic and ethical side of telehealth. Because with all this amazing technology, we've got to use it responsibly.
Absolutely. That's
Yeah.
crucial.
Okay, folks, get ready for some serious aha moments. This is going to change how you think about healthcare and your role in it. So let's jump right in. First up, designing e-health programs. I know this might seem basic, but can we just quickly define what an e-health program even is?
Oh, absolutely. It's basically any digital resource you can think of that's aimed at public health, like think websites, apps, online communities, anything trying to raise awareness or help people manage their own health.
Okay, so it's a whole digital toolkit for health education and self-management.
Exactly. And like we were saying, these programs need to be designed with different generations and cultures in mind. It's about meeting people where they are.
Totally. So, like, how do we actually tailor these programs for, say, baby boomers versus Gen Z? They're pretty different demographics.
Right. Huge differences. So baby boomers, for instance, they often prefer things a bit more well-structured.
Like clear steps, straightforward information.
Exactly. Think like a really well-organized online course, maybe with some interactive elements, but not too overwhelming.
Makes sense. So something like a virtual disease management tool where you walk them through managing their condition.
Yeah, perfect example. Then you've got Gen X. They tend to be super self-directed, value flexibility.
So for them, maybe something like a web-based patient portal would work well, where they can access their info whenever they want.
Totally. Like late at night after everyone else is asleep, that kind of thing. Then you hit millennials, true digital natives.
Oh yeah, they grew up with all this tech, so they expect a smooth, interactive experience.
For sure. They love health apps with notifications, social media campaigns that give quick tips, and definitely shareable content.
Right. Got to be able to share that info with their networks. Makes total sense. And then there's Gen Z. What works for them?
Okay, so Gen Z, they've grown up with video, instant communication. It's their world.
So they probably want platforms that feel like the social media they use every day.
Absolutely. AI chatbots that give immediate answers, telemedicine that's super intuitive, that's what they expect.
It's fascinating how each generation has these unique needs. But like we said, it's not just age, right? Cultural sensitivity is just as important.
Yeah, super important. We're talking about making sure health info isn't just translated into different languages, but that it actually connects with people's values and beliefs.
Like a mobile health app that offers dietary guidelines.
Oh, perfect example. Those guidelines need to be medically sound, sure, but they also need to fit with the culture's food preferences, traditions, all that.
Otherwise, people are going to tune it out.
Yeah.
It's got to resonate.
Oh,
Okay, so we've got these tailored e-health programs. Now, how are we actually using tech to educate people about their health, like in real life?
so many ways. First off, websites and patient portals are still super important. They're like the central hub for good evidence-based info.
Right, a place to go for reliable health information.
Yeah.
Patients can learn about their diagnosis, meds, all that.
Exactly. They can check their lab results, see upcoming appointments all in one place. And for you as a future nurse, this means patients might come in already knowing some basics, so you can have a more informed discussion.
I like that, more informed conversations. Okay, what about wearables,
Yeah.
like smartwatches, fitness trackers? Are those part of patient education now?
Totally. These things empower people to track their own health, see their metrics, and really get involved.
So they can see their steps, sleep, heart rate, all that good stuff.
Exactly. And it gives them real-time feedback, which can be so motivating. It helps them connect the dots between lifestyle and health.
Powerful stuff. Okay, mobile health apps. They're everywhere. What role do they play in all this?
Oh, they can do so much. Medication reminders, for example, huge for helping people stick to their treatment plans.
Right. No more forgetting to take your pills. What else can they do?
Symptom tracking. People can log their symptoms over time, which gives them and their doctor super valuable data.
So it helps with diagnosis, maybe leads to more personalized care.
Exactly. And then you've got VR, virtual reality. This one's really cool.
Yeah, the learning plan mentioned VR. Sounds futuristic. How's it used?
It's great for chronic disease management. Like,
Yeah.
imagine a new diabetes patient using VR to see how different foods affect their blood sugar.
Wow. That would make it way more real than just reading about it.
Right. It's immersive, engaging, and then there are AI chatbots. Have you seen those popping up everywhere?
Oh, yeah. Seems like every website has one now. What are they doing for health education?
They're great for quick answers to basic questions. Not a replacement for a doctor, obviously.
Of course not. But for simple stuff, they can be helpful.
Yeah, like defining a term, pointing someone to the right resources. It just makes things more convenient.
I can see that. Okay, so we've got all this information online, and honestly, it can be overwhelming. How do we even know what to trust?
Right. That's the million-dollar question. We've all got to be able to evaluate online health info, both as future nurses and as people just trying to take care of ourselves.
And that's where health literacy comes in.
Yeah.
Being able to sort the good from the bad.
Exactly. The digital world is full of health info, and sadly, a lot of it's not accurate, or it's biased, or it's just plain wrong.
Scary. So how do we teach ourselves and our patients to be critical thinkers online?
The learning plan gives us some great criteria to start with. Accuracy, authority, objectivity, currency, usability. Those are the big ones.
Great checklist. Okay, so accuracy. What makes a health website accurate?
Basically, the info has to be based on real, credible evidence. Look for sources, references to research studies, endorsements from trusted groups.
Like medical societies, research institutions?
Yeah, exactly. And be wary of sites making wild claims without any proof.
Red flag.
Ah!
Okay, what about authority? Who should be running the site?
You want to see content created or at least reviewed by real healthcare professionals. Doctors, nurses, pharmacists, people with credentials.
Right, qualified experts. And the site itself should be run by a reputable organization.
Yeah, like a well-known hospital, a university, a government agency that adds a lot of credibility.
Makes sense. Okay, objectivity. How do you know if a site's being unbiased?
Good question. It means they're giving you factual info, not trying to sell you something or push a specific agenda.
Right, no hidden motives. So be careful with sites that focus heavily on one product or treatment without mentioning alternatives.
Definitely. And look for transparency about funding, like who's paying for the site. Could there be conflicts of interest?
That's important. Okay, currency. Medical knowledge changes so fast. How do you know if a site's up to date?
Look for dates. When was the content last reviewed or updated?
Simple as that. If it's years old, it might be outdated.
Exactly. Things change quickly in healthcare. And finally, usability. A site can have great info, but if it's impossible to use, what's the point?
Right. It's got to be user-friendly.
Exactly. Clear structure, easy navigation, plain language. That's what we're looking for.
So, like WebMD versus some random health blog, the difference is usually pretty obvious.
Yeah, good example. WebMD, they're not perfect, but they generally follow those principles. Accurate info, medical professionals involved, all that.
But that random blog could be written by anyone, and the info might be totally unreliable.
Exactly. Always double check those sources. And actually, there are a couple of tools that can help with all this.
Oh, tell me more.
There's the HON code certification, which is like a seal of approval for health websites. It means they meet certain standards.
Interesting. So if you see that HON code logo, it's a good sign.
Exactly. And the National Library of Medicine, the NLM, they have some fantastic resources for evaluating health info online.
Great. So we've got tools to help us. That's encouraging.
Yeah.
Okay, let's shift gears a bit and talk about governments. What are they doing to improve health literacy?
So governments are launching all kinds of initiatives, basically programs and policies aimed at helping the public understand and use health info. And informatics is a huge part of that.
Okay, so it's not just about handing out pamphlets anymore.
Right. It's about using tech to get this info out there, make it accessible, make it actually useful.
I like it. So what are some concrete examples of how they're using informatics?
Well, first off, they're supporting health information exchanges, or HIEs. These are secure systems that let healthcare providers share patient info.
So a doctor, a nurse, a specialist, they can all see the same patient data.
Exactly. It leads to more coordinated care, which ultimately helps the patient understand what's going on. And for you, as a future nurse, working in a system with a good HIE, it means you have a much more complete picture of your patients.
That's a huge plus. Okay, what else are governments doing?
They're pushing for open access to electronic health records through those patient portals we talked about.
So people can actually see their own medical history.
Exactly. It's all right there. They can review notes, understand instructions, ask better questions.
Empowering, right? Gives them more control over their own health.
For sure. And they're also funding telehealth programs, especially in rural areas.
Ah, yes, bridging that gap between urban and rural healthcare.
Exactly. Telehealth connects people with specialists, gives them access to resources they might not have otherwise.
Amazing. So all these initiatives, are they actually making a difference? Like, are we seeing real results?
We are. Studies show that improved health literacy, helped by these tools, can actually lower hospital readmission rates.
Makes sense. If people understand their discharge instructions, they're less likely to end up back in the hospital.
Exactly. And it helps them manage chronic conditions better. They can track their symptoms, make good choices, know when to get help.
And that leads to more preventive care, right?
Yeah.
Catching things early.
Absolutely. When people understand the benefits of vaccines, screenings, healthy habits, they're more likely to do them.
It's all connected. Okay, let's move on to something called learning healthcare organizations. What are those?
So picture a healthcare system that's built to continuously learn and improve.
Learning and improving. That's what we all want, right?
Right. It's about using data, tech, and research to make healthcare better every single day.
Okay, I like the sound of that. What are the hallmarks of this kind of organization?
They're really data-driven. They use data analytics, even AI, to figure out what's working, what's not, and how to improve.
So it's not just about collecting tons of data. It's about using it in a smart way.
Exactly. They're also super collaborative. Doctors, nurses, therapists, everyone works together, communicates effectively.
Team effort all the way. And the patient is at the center of it all.
Absolutely. Patient-centered care is essential. They get feedback from patients, actually listen to their experiences and preferences.
That makes so much sense. And they're not afraid to use new tech, right? They're constantly adapting.
Exactly. If there's a tool that can help them learn and improve, they'll try it out. New AI tools, telehealth platforms, data visualization, they're all on the table.
So it's a dynamic system, always evolving. Can you give us an example of how this works in practice?
Sure. Imagine a hospital using predictive analytics to adjust treatment plans. Like, they might use AI to figure out which heart failure patients are at highest risk of problems.
Wow. So they can intervene early, maybe prevent a crisis?
Exactly. Adjust meds, increase monitoring, provide more education, all based on data.
Powerful stuff. Okay, let's talk AI more broadly. It's transforming healthcare in so many ways.
It really is. Machine learning, algorithms, automation. It's all about making better decisions, being more efficient, and ultimately understanding health and disease better.
We've already touched on predictive analytics. What other areas is AI making a splash in?
Automated clinical documentation is a big one. AI can transcribe patient encounters, like a conversation with the doctor, and summarize it, or even populate the medical record.
Wow. So it cuts down on paperwork, frees up time for doctors and nurses to actually interact with patients.
Exactly. And it makes the data more complete and accurate, which is crucial for research.
Right. Good data leads to better knowledge.
Yeah.
What about AI as a decision support tool for clinicians?
Oh, that's huge. AI can analyze tons of medical literature, guidelines, patient data, and give doctors insights and suggestions.
So it's like having a super smart assistant, helping them make diagnoses and treatment plans.
Exactly. The learning plan talks about IBM Watson and how it's being used to analyze cancer treatment options. That's a great example.
Yeah, I was going to ask you about that. How does that work?
So, Watson can process mountains of data about different cancers. Research papers, trial results, individual patient info. It takes it all in.
And then what? How does it help?
It helps oncologists pinpoint the best treatment options for each patient based on their specific situation. Super personalized.
Wow, that's next level stuff. Okay, let's zoom out a bit and talk about community and population health. How's informatics being used there?
So, population health informatics is all about using data to improve the health of whole communities, not just individuals.
Big picture stuff. I like what tools are they using to do this?
They've got geographic information systems, or GIS, which let them map health data and see patterns.
So they can see where outbreaks are happening, where certain conditions are more common.
Exactly. They can also see environmental factors like air quality that might be affecting health.
It's all connected. What other tools are they using?
Public health dashboards. These are online platforms that give you real-time data on a population's health.
So like rates of chronic disease, vaccination rates, things like that.
Exactly. It helps public health officials track trends, spot problems, and see if their programs are working.
Data-driven decision-making. We talked about that before. What about those mobile health clinics? How do they fit in?
They're amazing for reaching underserved communities. They can provide care on the go. And with informatics, they can connect with specialists remotely, collect data, all that.
So it's not just about providing care. It's about collecting valuable data that can help the whole community.
Exactly. And then there are disease surveillance systems.
Hmm.
Super important for public health.
Especially now. With everything that's happened in recent years, we've all learned how crucial those systems are.
Right. They're all about tracking diseases, spotting outbreaks early, and responding quickly. Informatics helps them manage all that data and make sense of it.
The learning plan mentioned the CDC using these systems to track COVID-19 hotspots. That's a great example of informatics in action.
Totally. They were able to analyze data from all over the country, see where cases were surging, and make recommendations.
It helped them target resources and hopefully slow the spread. Okay, final topic, telehealth. We've touched on it throughout our conversation, but let's dig into the socioeconomic factors and ethical considerations.
Sounds good. So telehealth, as we know, is delivering healthcare remotely. And how well it works, how accessible it is, all that is influenced by socioeconomic factors.
Makes sense. Not everyone has equal access to technology or internet.
Right. So one big driver of telehealth is the gap between rural and urban healthcare. Telehealth can connect people in remote areas with specialists they wouldn't be able to see otherwise.
It bridges that geographical gap. What about older adults? How does telehealth help them?
Oh, it's great for them. A lot of seniors have trouble getting around, or they have chronic conditions that make travel difficult.
Telehealth lets them stay home and still get the care they need.
Exactly. Checkups, medication management, therapy, it can all be done remotely.
Makes life so much easier. And from a financial standpoint, does telehealth have the potential to save money?
It might. It could reduce expensive ER visits, cut down on travel costs for patients, and maybe even lower the overall cost of running a healthcare facility.
Interesting. So it could make healthcare more affordable, which would be huge.
It's definitely something researchers are looking into, but even with all the potential benefits, there are also ethical and legal things we need to be careful about.
Right. We're dealing with sensitive health information, so we've got to be responsible.
Absolutely. One big challenge is licensing. Nurses and doctors are licensed by state, but with telehealth, you might be treating a patient in another state.
So the rules might be different.
Yeah, it can get complicated. And of course, privacy and security are paramount. We have to follow IPA and make sure patient data is protected.
No data breaches. And lastly, the learning plan mentioned equity concerns. Can you explain that?
Basically, telehealth is great, but not everyone has equal access to the technology it requires. Low-income folks might not have reliable internet or a computer or smartphone.
That's the digital divide. It's a real barrier.
It is. So if we're not careful, telehealth could actually worsen existing health disparities.
That's not what we want. So what can be done about that?
We need to address those disparities head-on, provide affordable internet access, maybe even devices, and definitely digital literacy training.
Makes sense. Everyone deserves access to good healthcare, regardless of their income or tech skills. Okay, wow, we've covered a ton of ground today.
We have. From designing those e-health programs to the complexities of AI and telehealth, it's a lot to take in.
It is. But it's all so important for the future of nursing. We've talked about the specific tech, but I think the bigger takeaway is that informatics is woven into every aspect of healthcare now.
It really is. And for you, as future nurses, understanding these concepts is crucial. It's not just a nice to have, it's a must have.
Absolutely. It's how you're going to deliver safe, effective, and equitable care in this digital world. So on that note, I want to leave you with a final thought. As you continue your nursing journey, think about this. With all these incredible advancements in healthcare informatics happening all around us, what are some ways you can use these tools to make a real difference in your future practice?
It's a question worth pondering. And we have no doubt you'll all find amazing ways to leverage this tech to make healthcare better for everyone.
Couldn't agree more. And with that, we wrap up another deep dive. Thanks for joining us, everyone, and best of luck in your studies and future careers.